Okay, good afternoon, everybody. Welcome. I'm so glad you could be here. My name is Laurie Wolf, President and CEO of the Foraker Group, and very pleased to offer you this conversation on that we're calling our Rapid Relief Series, which is everything related to how all of our organizations are navigating the challenges and opportunities coming out of federal policy and funding changes. For those of you joining us for the first time and you're new to Foraker, welcome to Foraker. We're happy to have you here. We offer a whole range of services for nonprofits and tribes all across the state of Alaska. We're happy to be a part of a wonderful network of people that you're going to hear from today, all providing amazing services for Alaskans across our great state and across the nation. We'll hear more about that in a few moments. If Foraker is new to you, please there's lots of people on the screen with little mountains behind them. And those are the Foraker, many of our Foraker team. You're welcome to reach out to any of them at any time during this conversation and find out more about how we can be of service. And at the very end of our time together, we'll have some contact information. So again, if you're new to our team, to our opportunities, welcome. And if you've been here with us for the 25 years of Foraker's existence, thanks for coming back again. Appreciate that. Part of our effort in Rapid Relief is to track all the things that are going on, specifically that impact nonprofits. And this is a screenshot of our homepage on our website where we're tracking regular updates. And we're doing that also in partnership with our partners at the National Council of Nonprofits. And we have a guest here that will speak more about that. But if you click onto this place on our website that you can get to either from the Speak Up button or directly off of the scroll page on our homepage, you can find all the latest information that we have that we can share that aren't behind paywalls. And if you're not seeing something and you have questions, you can also just reach out to us at any time. We're doing our best to keep this information as updated as possible in a very rapidly changing environment. Do just want to take a moment and just recognize that I am joining you from my office here on Dena'ina land here in Anchorage. And we do have our team all across the state. Happy to have you all with us. And I also just want to take a moment to recognize our board members who might be joining us on the call, but also the Rasmussen Foundation and the MJ Murdoch Charitable Trust, who have graciously funded Foraker to offer all of our rapid relief opportunities, including one-on-one support for those navigating these changes, either free at or a deeply discounted rate. So thanks to them for creating this space for us to support all of you. In particular, into our team, while not on the agenda, I just want to call out Mike Walsh, our Vice President of Public Policy. If you have questions around public policy, he'll be monitoring the chat bar as well as many members of our team. And so just feel free to reach out to any of us during this time. We do have there's a lot of you joining us today, so we do have some agreements in our Zoom room. First of all, your microphone is unmuted and we're gonna keep it that way. So if you wanna communicate with us, we encourage you to use the chat bar. Again, our staff is monitoring that as we go. We are booting out those AI chatbots and note takers and all those things. So if one of those things is just automatically connected to you, we are disabling it. And we just ask you don't have our permission to record this program. We are recording it ourselves, and we will distribute it on our website for you so you can share it when we do that. We already know we're not going to have time for all of your questions, so we are going to just try to summarize the questions that we get, but we do want you to ask your questions. That actually helps us help and know what is on your mind. So please ask your question. Again, all of our team is monitoring that chat bar. If we can answer it quickly, we will. Otherwise, we'll save it and we'll find ways to get answers to you over in a variety of ways. So thanks again for doing that. Last bit of housekeeping, just that the rapid response series so far that we've offered, some classes, some opportunities, some topics that have been really interesting already. Some of them have been recorded, some of them not. We might offer them again, those that are not recorded. And then we are offering some free, what we're calling office hours on a variety of topics. So if these are areas where your team has questions and you want to get with one-on-one with one of our team members, you can sign up for those. Those are all free. Okay. that's enough with housekeeping. Let's turn to why you all signed up for this conversation in the first place, which is the tax bill that has just come out. Obviously, the tax bill has so many topic areas. I couldn't even list them all on the screen, but there are so many ways that this piece of legislation, this tax policy, is going to impact our lives here in Alaska. We're going to talk about some of those topics today with our wonderful guests. We'll make room in other places to talk about other things, and we'll do our best if we have other resources for you to connect to, like our friend Tiffany here, who's going to talk to you, has a lot to say about student loan debt and the pieces of the bill that speak to student loans. We don't have time to talk about that today, but we do have a link to share. So when we have a link, we will put that in the chat bar for you or offer you another opportunity to get connected to issues as you go. For sure, today, our intention is to offer you a very big picture, a first blush, if you will, about what we see in the bill and what we're continuing to watch. There's still plenty of information we don't know about the ultimate impact of the decisions that have been made. And we also know that the decisions that have been made, the way that they're going to take effect, some will be immediate and some will take years for us to fully know their true impact. Both positive and challenge. So we are all, in some cases we know exactly what you know, and in some cases you might know some more things than our esteemed panel. But I think our panel is ready to share with you what they are, the pieces that they're kind of highlighting and keeping track of, and the things that they are asking questions about. So we still all have plenty of questions, and we're looking all across the country to look at what that means and what the special provisions for Alaska might mean for us as we go. So joining me today, we have a wonderful group of people joining us today. Tiffany Carter, Public Policy Director at the National Council of Nonprofits, our trusted partner in DC. Jordan Marshall, our trusted partner on the ground, who is our legislative consultant, going to share with us some thoughts about the state of Alaska and the impact and response to the federal funding. Ben Mallott, President and CEO, Alaska Federation of Natives, will be focusing in this conversation specifically on Indigenous and impacts on tribes and rural Alaska. And Nils Andreassen, Executive Director, Alaska Municipal League, will be focusing on the impact on local governments, might have some things to share with us about the infrastructure and energy projects. We'll see what else he's got up his sleeve. And then Monique Martin joining us, Vice President of Intergovernmental Affairs at ANTHC. Gonna answer, I hope, we have a lot of questions already around Medicaid and SNAP, and she'll just do her best to talk about kind of impact overall for healthcare in rural and urban Alaska. It's a lot to try to cram into a very short amount of time. So again, we're going to hit the high points. I've asked each of our guests to just introduce themselves so we don't take too much time to do that. And then to give us, really their top issues, what they're paying attention to. And we might attempt a conversation along the way. We'll see how we go. And again, at the end, we'll have time for your questions. You're welcome to post your question at any time, but we won't take them until the end. Okay, are we ready? Here we go. We're going to start big and we're going to narrow down. So we're going to start with Tiffany sharing a broad perspective about nonprofits in general. So with Tiffany, I'm going to manage your slides and you're off to go.
All right. Well, thanks for having me. It's always good to join everyone in Alaska. I think I've even seen some familiar names in the box. So good to see you all. As Laurie said, we are the National Council in DC. You can just jump to the next slide. We like to say we champion, connect, and inform the nonprofit sector. We represent about 35,000 nonprofits across the board. Laurie used to be on our board of directors. But if you are a member of Foraker, you are a member of ours. And so that is a key point of this. And we show this slide to show the network across the country, to say you are not alone. I know that you are working every day for your communities, for your tribes, for the people on the ground, and know that there are other nonprofits across the country who are doing the same thing. So thank you for fighting every day for your communities. Next slide. But we are here to talk about the tax bill, the 2025 tax bill, HR 1. How did we get here? We're here because of 2017. And I joked at the end of last year that I really didn't want to relive 2017, but here we are reliving 2017. And the reason for this is because they passed a quote, once in a generation tax reform bill. That was $1.5 trillion worth of reconciliation, tax breaks, tax benefits, and a lot of those provisions were ending at the end of this year. And so in the first Trump administration, they passed this bill. It was just a party line vote. They needed to pass it again this year before those provisions expired to be able to still receive those benefits. And so that's why this year it matters so much. And it happened to be during President Trump's second term. Next slide. So just like in 2017, there were a lot of provisions that affected the nonprofit sector. So I'm just going to hit on a couple because I know we don't have a ton of time, but these are kind of the big ones that I think really affect you on the ground. The first one was, there was a couple provisions that were going to create either new or expand taxes on nonprofits, which is crazy to think about, right? So we know nonprofits pay taxes. We don't pay income tax, but there are other types of ways to tax nonprofits. And one of the biggest things, especially for the philanthropic and foundation groups on the call right now, there's a provision that was trying to increase the private foundation excise tax. So this came out of 2017. In 2017, they created a brand new tax on private foundation income on investments at 1.39%. And what they wanted to do this year was increase that as a pay for the bill to be able to pay for all the other tax cuts. They wanted to increase the amount to up to 10% based on a tiered approach, based on how much money the foundation had already. And so because of very strong advocacy by the nonprofit sector, we knew that if you were going to increase those taxes, that would lower the ability for foundations to support nonprofits on the ground. And so this became a very big issue, and we were able to remove it in the Senate, which was fantastic. So it stays at 1.39%. We couldn't get rid of it completely, but it didn't increase. There's also another provision on unrelated business income tax. I don't think it affects you as much. It was more kind of a big city situation, but this came out of 2017 too. I actually just called it the stupid provision. I went into offices and said, this is so dumb that we did it in 2017 and got it repealed. And so we got that out excluded too. It would have created a 21% tax on transportation benefits. So if you were paying for parking spots or something like that. So these were wins. We were happy to see the Senate get these things removed before they passed the bill. Next slide. I'm gonna go do these out of order. The bottom one first, so that I can end on a good note, because we always want to end on a happy note. But there is this provision for individual giving, for charitable giving to nonprofits by individuals, by people just supporting their communities every day. And the problem, though, is that they were doing these fancy tax things called caps and floors. And what happened is they adjusted how people were able to file their taxes and what needed to happen based on how much you gave and then how much you were able to give because of the way you filed your taxes. So there are two ways to file your taxes, and I'm not trying to talk down to anyone. I walked into so many offices on the Hill and said there's two ways to file taxes, and people like Hill staffers just gave me these blank deer in headlights looks. One is most people, somewhere around 95% of people, take the standard deduction, and that just means you file your taxes, you do your regular taxes, and you have to have these certain numbers. But then other people take what itemized, and it's usually around $150,000. If you are making that much, that's about where it breaks, and you can itemize deductions out of it. What they did was they said, we're going to cap how much you can itemize, 35%, even though the actual amount is 37%. And whenever it comes to giving, we're going to create a floor. So I'll get to that in a second. So they created these new platforms, meaning you could only give within this specific band for charitable giving. That didn't turn out. So it ends up not being a great thing for us. And so I'll come back to that, but I just want you to remember that there's two ways to give, and they created these weird floors and caps. So that's for individuals. The other thing is for corporations. So if you're an organization that receives corporate giving, these are only for C corporations. So the big corporations that are double taxed. You have to give a 1% floor before you see any benefits of that. So this means, say I'm going to use ridiculous easy numbers, right? If you have $100, you have to give over $1 before you can get a tax deduction for it. So you'd have to give $2 and then you only receive a $1 break. Now, think about this. This is really at the tens of millions of dollars amount instead of the $100 to be able to receive that benefit. So if you are an organization that works with the local corporation in your town for something like T-ball shirts or baked goods for the bakery, the bake off or something, this is where these things come in. It might not actually incentivize that group to give. We know that people give because they want to support their communities, but the incentive has been lost in these two floors and caps. But the good news is, for everybody else, all the other individuals giving, they can now take a deduction. They can now take an itemized deduction. So going back up to the top. So for everyone who takes the standard deduction can now give up to $1,000 for individuals and $2,000 for couples and receive an above the line charitable deduction for those donations. So this has never been, they had like a really small option during COVID, but it's never been this amount. It's never been available this widely. And we're hoping that this incentivizes individuals to give. Why I mentioned the floor is this is being paid for by all of the itemizers, everybody else taking the other deduction at a 0.5% floor, meaning for individuals who are itemizing, they have to give more than 0.5% of their taxable income before they can get a deduction. So it's a lot of like tax mumbo jumbo. The good news is we now have a non-itemizer. The chip on the shoulder that we have is we have to pay for it, and it's being paid for by the other people who normally give to charitable deductions as well. So those are kind of the big ticket items for this tax bill that we were looking at. Next slide. I know that Laurie, you were asking about kind of what's next or other situations. This is how this all plays into the future, right? We're looking at a final cost of this tax bill around $3.5 trillion, which is a lot of money. The House thought it was going to be around 4. The Senate thought it was about 4.2. The final numbers are a little bit lower, but that's a lot of money. And so this is going to cut into the ability for the federal government to be funding other things through grants and contracts. We know that they're trying to stop a lot of grants and contracts. It's going to limit the amount of corporation giving. It's probably going to limit some big high net individuals giving. And so it's probably going to play into the ability for nonprofits to fundraise and to be receiving the same amount of funding that they had previously. So that's kind of how this plays out in the long term. A couple other things, Laurie, I know that we're running short on time, but there are some big other issues. We are really fighting to protect what's called the Johnson Amendment, maintaining nonprofit nonpartisanship. Laurie mentioned at the beginning, we are nonpartisan. We have to be by law, fact, and impact. But there is some efforts to remove those protections and allow nonprofits to support or oppose candidates for public office. That is what you are not allowed to do under current law, but there's some legislation looking to get rid of that. Next slide. And there's a lawsuit right now that's moving forward in Texas that would also do that. So this is really concerning. There's a bunch of other plays also with executive orders, regulations. The Treasury and the Internal Revenue Service is looking to not enforce the Johnson Amendment through regulation, and then also by this lawsuit, next slide, in Texas. And so we are fighting very, very hard right now to maintain this. I know that Foraker has a bunch of resources on this as well, specifically. So I highly encourage you to check those out. That would allow you to support maintaining nonprofit nonpartisanship and maintaining the status quo of not allowing partisan acts into our work so that we can maintain public trust within the sector. So I jumped over that really fast because I know that we're running out of time, but Laurie, I'm happy to answer more questions later, or you're always welcome to contact me, and I can go more into details when we have a bit of time.
Awesome. Thank you so much, Tiffany. That's an awesome overview. There's so much again going on. I'll just say briefly, we were at the introduction of the bills of the bill, a bipartisan bill to have the universal charitable deduction. We were so excited about it because after 2017, only 2% of Alaskans actually itemized. So we were really excited about the universal charitable deduction. And it just got buried in this bill. So we had a moment to celebrate, but it got a little buried in kind of all the other things that were going on. And then with the corporate cap piece, we're kind of not really sure what to think at this point. So we'll be watching closely here at Foraker about the impact on charitable giving, both from a corporate perspective and individual donor perspective. So it was a moment to celebrate. We're still excited about it. It was almost a decade in the making, but here we are. So again, thanks, Tiffany. We're gonna switch gears, and again, I just encourage you to watch the chat. We are posting links to information. We just posted. Danny just posted some information about the Johnson Amendment. We'll have more information about that soon. Wanted to work through this webinar first, and then we'll have more information for you shortly. I am noticing a couple questions in the chat really related to ballot measure 1, which is a state initiative around how we pay people in our state. We're not going to be talking about that today. This is the federal tax policy. So those of you with questions, will post an FAQ for you, questions that people are getting in that as well. I know there was a little confusion there. With that, I am going to turn to the state. Jordan Marshall joining us to talk state reaction and reflection and next steps around federal policy. So with that, Jordan, I'm going to put your first slide up and away you go.
There we go. Unmuted. Good afternoon. My name is Jordan Marshall. I have the pleasure of serving the Foraker Group as a state lobbyist. I've been engaged with state policy issues in one capacity or another for the last 25 years, and for the last 10 years as an independent contract lobbyist. First, before talking about the slide, as it relates to HR 1 and how it might impact the state, it's important to mention the provisions in HR 1 that are designed to encourage new oil and gas exploration and production, and the increased share of revenues for Alaska from those development prospects. HR 1 tilts the revenue split between the state and federal shares in the state's favor, and that's likely to be a net positive for the state budget if those developments come to pass. Not to mention the direct benefits to people and the economy when Alaskans are working. But those provisions are not near-term money in the bank, nor are they a sure thing. These provisions in the bill are championed by our delegation. They're super proud of it, and for good reason. And it would be negligent not to mention that they are items that might help us down the road. I am not expert in those provisions, and they are things for the future. If there's someone who knows more about that, perhaps we'll get to that. What I can tell you is that whether and when those make an impact to the better for the state budget is unknown. Okay. And before I talk about HR 1 and its impact on the state's bottom line, I'd like to call up this slide you see on the screen that represents the big buckets of funds that make up the annual state budget. This slide, and it's, I sourced it, it's the Department of Revenue, the state's Department of Revenue Spring 2025 Revenue Forecast presentation to the legislature. It points out, and this is important for us as we think about the impact of a federal budget bill, that the largest amount of each year's state budget comes from the federal government. And Medicaid is part of that, as are a lot of transportation funds, some criminal justice funds, some education funds across the board throughout the state budget are federal funds. Nearly 40% of our state budget comes from the federal government. Let that sink in for a second. The second largest impact for our input for our state budget comes from investment earnings. And those are specifically the earnings from the permanent fund. For decades, the earnings were piled back into the principal of the fund, growing it, and used for inflation proofing and most famously for dividends. Those earnings have taken on a larger role in supporting state services over the past decade since lawmakers started using earnings to support essential state services. You've heard of the percent of market value, or the POMV draw, capped at 5% of the annual value of the permanent fund, averaged over 5 years. This is kicking out about $3.8 billion per year to be used to be sent to the general fund. Some of that's going to dividends, and the lion's share is now going to pay for essential state services. There was a time not too long ago when oil revenues made up 80 to 90% of the state's annual revenue. Today, you can see here that the barrel of oil icon there, it shows that that number as a percentage of state budget is now below 20% of our annual state budget. Oil revenues make up about 20% of the state budget. The remainder is made up of equal parts federal funds and permanent fund earnings. That's why today's conversation about what happens with the federal budget is so relevant to the state in a lot of ways. You'll note also there's a tiny selection of additional revenues from fish, tourism, and mining and timber. Those are not decimal dust, but they don't rank as major players that have material impacts on our annual state budget. So I'd like to turn back to, you just keep that slide on or kill the slide. I don't know that I'll get to the other two that I queued up unless it becomes part of Q&A later. But as it relates to the impact of HR 1 on the state, there are some Alaska-specific carve-outs and exemptions in the bill that some of today's panelists will unpack in detail. My attention was piqued by sections in HR 1 that impact Medicaid and SNAP primarily, because they both play such a key role in keeping Alaskans healthy. For context, Medicaid makes up $3.08 billion of the state's annual budget. 2.6 of that is federal. So the lion's share, almost 2/3 of it, or more than 2/3 of it is federal funding. 1.1 billion comes from the state to draw down federal match dollars. Any dent in that will have a real impact on residents and the nonprofits who serve them. And I don't want to steal anybody's thunder who knows more about the Medicaid portion than me, but I will say that the state's tribally enrolled Medicaid beneficiaries are eligible for a 100% FMAP, the Federal Medical Assistance Percentage, which in the case of Medicaid services for tribally enrolled Medicaid beneficiaries costs the state nothing. Please note that dynamic is not only allowed health care standards in Alaska to be higher for everyone across the board than it would be otherwise, but it also was allowed for the state budget to save over $250 million over the last decade in distribution of services for eligible Alaskans. I would also note, running off script, that if it weren't for the strength and robust stability of the state's tribal health organizations across the state, we would have had a much more difficult time managing our way through the pandemic. So I'm gravely concerned about the impacts of the federal budget changes as it relates to Medicaid. But more on that from Medicaid specialists. I wouldn't dare get in front of Monique on that. My biggest contribution to today is to say a word about SNAP, the Supplemental Nutrition Assistance Program, or food stamps program. And before I go any further, I want to give a shout out to our friends from the Food Bank of Alaska who work closely with our congressional delegation, who were very interested in finding out how the budget would impact the state of Alaska. Our delegation worked with Food Bank to highlight the importance of SNAP and to assist in building the case for Alaska exemptions. HR 1 has provisions that delay implementation of its changes until after the midterm elections. Let's call that a gift. The current structure of SNAP has been that the state splits the cost of administering the program with the federal government 50-50, and the entire cost of the SNAP benefits is covered by the federal government. That means that other than the administration of the program, which we know has been plagued with problems for the past 3 years, the actual $230 million per year in federal SNAP benefits due to eligible Alaskans don't cost the state a penny. All right. We know, however, that the state got arrears in processing SNAP eligibility applications to such a degree that eligible Alaskans were waiting for months for benefits and going hungry in the meantime. This was such a problem for the state that to serve its role, that the federal government penalized the state, and the courts held that the state was not doing its job. All right, this is before the bill, y'all. Things were so bad that the Division of Public Assistance that administers the program decided, and this is a good thing, to keep providing benefits while they work through the backlog. This decision is critically important for Alaskans, but it also helped contribute to additional costs and also owing to a misread of rules that meant most benefits were calculated incorrectly, even if it was by just a few dollars, that our error rate for calculating and distributing benefits through SNAP, error rate shot through the roof and is now the worst in the nation. Congratulations. So as it relates to HR 1, HR 1 says we have to start paying a benefits match to share the cost of SNAP moving forward, of the SNAP benefits. And based on our error rate and the likelihood of us being able to get in front of this, by the time the HR 1 provisions related to SNAP kick in, the state will have to come up with $37 million per year. This is a solid estimate starting in FY30. And again, that's not immediate, but that's real and that's coming, and that's the law. We're going to have to come up with a percentage to match. Instead of getting 100% from the federal government of SNAP benefits, we're going to have to start paying a share, and it should come to about $37 million. Plus, the cost to administer the program also goes up as of October 1st, 2026, from 50% or even split with the feds to administer the program. We're going to have to start paying 75%, which should cost the state an additional $10 million a year, starting in FY27. So that's $47 million that we don't currently spend on SNAP that we'll have to pay to keep a levy just exactly as we are today. Okay, and that's including our issues with understaffing, vacancy, delays. Now, it's important to note, and this is super important to note, the state of Alaska and the legislature have been leaning into this with real intent and verve and cash. Over the last several years, the state has invested tens of millions of dollars in improving the hardware and the software, that improving technology and opening storefront customer service for people who otherwise wouldn't be able to work with an eligibility technician. But I would note that the state also proposed a $10 million increment in the FY26 budget. The state did that said we want to improve our virtual call center to improve how we're able to provide these services to the state of Alaska. That funding was vetoed. So there's that. But the state has also set up an online eligibility portal. There are improvements underway. We are not going to meet, an error rate threshold, though. I predict we will have a hard time, if not impossible, to meet the error rate thresholds that would allow us to avoid some of the costs I just mentioned. So start adding to the must-have to the state budget in the near future, a roughly $47 million increment out of whole cloth. And if you do want to pull up my second slide, I will show you something.
Jordan, I'm going to do that. I'm going to do that in. I can pull it up in a second, but we want to definitely make time for questions. So,
all right,
I can
done.
pull it. I can pull it up. I want you to say what you're going to say without the slide and just say it.
I was going to say right now, the only way we have in the state of Alaska, for whatever reason, to pay for $50 million is to continue to reduce the size of the permanent fund dividend. Now, I'm not saying that we don't have other options. I'm saying that is the only way that the state has been making choices to pay for cost increases. It has been coming from the dividend. And that is, that's a completely different conversation. But in the absence of any kind of broad-based, and I'm not pitching anything here, I'm just saying we do not have a diversified funding portfolio in the state of Alaska. And when we have chunks of cash that need to be paid and coughed up in the size that I'm talking about, if barring any dramatic, shocking change from the people of Alaska demanding that we diversify our revenue portfolio, we know where that money is going to come from. Thank you. And
Thanks,
there's
Jordan.
another option. If we didn't come up with the $47 million, we would have zero SNAP. Zero SNAP. That's a $230 million loss to the tummies of Alaska and to the people who run the grocery stores that provide that nutrition.
Thanks, Jordan. Appreciate
Heads
you.
up. All right.
Thank you.
And there's all sorts of other good stuff about it's not good and we've got
It's good.
we're
It's good,
calling them
Jordan. It's
time
good.
limit
It's good.
time limit work requirements. There's a lot about that. I will not get into it until later.
Yeah.
Thank you.
We'll
Now
do
hitting
another.
pause.
We'll do another.
Done.
We'll do a whole session on SNAP. I can tell there's lots to say. Ben, I'm going to turn to you. Ben Mallott, President and CEO of the Alaska Federation of Natives. Go ahead, Ben.
Thank Laurie. I kind of say this ditto to what Jordan just said. Anyways, thank you, Laurie, for having me. My name is Ben Mallott. I have the honor of serving as President and CEO of the Alaska Federation of Natives, or AFN. For a little background, AFN is a membership organization. AFN's membership includes 178 federally recognized tribes, 154 village corporations, 11 of our regional corporations, and 11 of our tribal regional nonprofits. So a majority of Alaska Native peoples and communities are represented through AFN's membership. And it's my job to kind of represent and advocate for the unified interests of that community and also of my membership. As we talk about the topic today, especially the budget bill, AFN's been working on really ensuring that our membership understands the process that this bill went through, why this is unique that happens really only every 10 or so years. So when you have, the same party in the White House and in Congress, and really, ensuring that our membership and the state kind of knows what's in the package, what's in the bill. And so that we're working with our partners, and I want to recognize Monique Martin from AHC. She's a real expert here on the work requirements for Medicaid, Medicare, and also SNAP. But also, as we looked at this bill, we really want to make sure that what is in it is very clearly communicated to our membership. I think Jordan did a good job of that, as well as Foraker Group. But really, as we look at this bill, there's a lot of different takes you can take on it. For AFN, obviously, we're going to focus on the work requirements, ensuring that those work for our communities. I don't want to step on what Monique's going to say, but we do have real concerns of how that process would go forward. A lot of that falls onto the state, and as Jordan said, doesn't have necessarily the resources to maybe implement a new program or a new service, or even to administer applications for SNAP or even the requirements to apply for an exemption. So through AFN, we're working with our partners. I don't want to take Monique's thunder, but I really want to hold her up in the work that AHC does, and ensuring that our membership and rural Alaska is not left behind. As we look at the bill too, there's also some opportunities, right? If you look at it, there is a lot of tax provisions, special tax provisions for trying to find my notes real fast. Not taxing tips or auto loans. But also there's money in there for, the $40 million for the Dominant Safety Alaska Aviation Safety Initiative. There's $300 million for a icebreaker in Juneau that our state has been advocating for a long time for icebreakers. $15 million for Arctic defense infrastructure. In general, in terms of the spending bill, there's $150 million for defense. Alaska has a large defense, industry, so and economy. Coast Guard 25 billion, and also aviation improvement 12.5 billion. So a lot of our rural Alaska communities suffer from having inadequate aviation weather and or communities or infrastructure. So there is opportunities in there that I think as AFN, as we go through this, we are looking at and how we could take advantage of those. But it really depends on how fast this administration could really get through its rulemaking and get the rules out and how that money will be spent. And that's really where the devil's deal is going to be, is how we actually take advantage of that and how we take, really track what is going to our state, what's not. Because while this bill is passed, it's recently passed, there's still a lot of work to be done on the ground. I also recognize too is that there's not really a timeline for these rollouts. The federal government has laid off a lot of people. So we don't know, who's going to be implementing these rules or when it's going to be, or who's going to be doing what. So like, while there's a lot of, I think there's more questions in this more questions or answers in terms of this bill now is passed than it was in the process as it goes forward. So with that said, as AFN works through this, working at opportunities, but also ensuring that, we could stay ahead of the curve and kind of mitigate some, any aspect that might be negative to our community, such as work requirements, but also too, how can we work within Congress and our delegation to find new opportunities too, right? You look at SNAP, one of AFN's longest priorities for SNAP was to allow tribes and tribal organizations to compact and actually have our tribe and tribal organization, administer that process for our communities and for our tribal citizens ourselves and kind of cut out the state. And so there's opportunities here that we can engage on with Congress and administration to kind of, make even for our tribal communities a little more efficient. But again, the rollout and I guess the devil is in details of how they're going to roll out a lot of this, a lot of these programs and work requirements and exemptions for Alaska. There's also the $15 billion Rural Health Transformation Fund. I think it's supposed to be, $250 for Alaska each year for the next 5 or 7 years. I'll let Monique talk more about that, but there is stuff in this bill that we should be tracking, but we got to track it very closely to make sure that it's being implemented correctly. And that's kind of where AFN's at. And I want to thank Monique and also Laurie for this because I think we're on the right track. I think with Foraker, we're in good company to make sure that while this bill is scary, does have a lot of unknowns, there's a lot we could work on together to do something. So I'm going to leave my comments there short for any further questions in chat, and maybe you address my time over back to Jordan. Just kidding.
That's awesome, Ben. Thank you. Well, I think you just pointed out a really important point that I just want to underscore for all of us, which is, some of these, we still are waiting for rulemaking for many of the aspects of this bill. And so we just, there's a lot of things that like we're watching, but until that rulemaking comes out, we just don't exactly know how it will come out. And it could come out in a really positive way, or it could come out in a really challenging way. And that's really all of our jobs, is to be paying attention to how it will play here in Alaska. And we know we have some pretty unique circumstances to make sure that, a national piece of legislation works for us. So I really just want to underscore that, Ben, and just really grateful to everyone who's joined us on this panel, but also who joins us in our advocacy and action calls, who are helping us keep our eyes and ears on the ground around the implementation piece, because I think there is so much more to come, and many years of this implementation. Again, I can't stress that enough, which is, some of these things will play right away. Like we talked about tax on tips, like that's a right away thing. But then there's a lot of things that we just won't see for many years. So just really appreciate that so much. Speaking of projects that take a long time, that are being tracked by the one and only Nils Andreassen, Executive Director of the Alaska Municipal League, tracking all those big, huge infrastructure projects. Nils, I'm going to turn to you, and let's hear your perspective from the local government space.
Yeah, thanks, Laurie. Hi, everybody. It's great to have so many of you together, and thanks again to Foraker for convening this. I mean, one, I would echo all the previous speakers. I think what I hear most often from local governments is that we have to wait to see, like, how is this going to be implemented for us to be able to make good decisions. Um, and and I think it's worth kind of stepping back a little bit and noting the noise, right? All of this, this bill comes in the context of 176 executive orders. And I don't know if you've read them all, but they're all on the Federal Register, and it's a lot. It comes in the face of a lot of noise related to tariffs and ups and downs and forward progress and backwards progress and new ones and old ones and so on. A lot of that has led to just additional uncertainty and questions. Um, just after this bill, there was rescission discussions, and there's still future rescission discussions, and they're trying to pass a budget for next year. So there's a lot out there to come to grips with that this fits into in lots of different ways, and also like there's other stuff to be paying attention to. So I think there's that. I think also to Jordan's point, we have a state who has to either implement or pick up the pieces, as the federal government, is retreating from some things and shifting more to state and local governments. And the state is not in a really good position to take on more, given its fiscal policy or lack thereof. And so I think it's really important to kind of layer all of these circumstances together into here's where we fit in. And for local governments, it's a level of government that has taxing authority that if the federal government retreats and the state government retreats, then local governments will have very bright lines around decisions that they have to make. And with 165 local governments in Alaska, cities and boroughs, they'll each have decisions to make in response to kind of what trickles down or doesn't from each of those other layers of government. And when it comes to this bill, there's a few kind of areas that I would focus on, and I'm glad that I don't have to tackle Medicaid or SNAP or some of the others, but they also have implications for local governments. So first on the kind of federal tax and fiscal policy, like it's not a bad thing if Americans have more money in their pockets, if that's an impact of this bill. And it might not be true for all things, but let's say that Americans had more money in their pockets. They will spend that money and local governments will tax those expenditures. It could mean more revenue for local governments. You take that plus tariffs and you get a lot of different you get a lot of variety in how that makes up, but ultimately you've got a taxing authority who could benefit from increased spending power or purchasing from residents. So that's an element, a wrinkle that makes it not so clean for us in kind of thinking about this bill. When it comes to healthcare, nutrition programs, the Medicaid and SNAP questions, rural hospitals, and so on, I'm glad I don't have to talk about it. But also it's worth knowing that some local governments have public health powers. Some local governments are running municipal hospitals. So there's a very direct connection for them in the experience that they might have from changes to those programs. And there will be impacts within the community that local governments will also have to wrestle with. And since we don't have county health departments and so on, it's not as direct, but where tribes are picking up the difference or nonprofits are picking up the difference, there's just I think how it will work is that local governments will be involved in and probably have choices to make about how they support our most vulnerable Alaskans. So that will be a decision point that many local governments wrestle with. When it comes to energy, natural resources, infrastructure development, I think, Jordan, you pointed out any natural resource development is going to take time. And there's a lot to plan for when it comes to that resource development. Future revenue potential, but also constricted in some circumstances. It's going to require more housing, workforce development, education facilities, support services, all of the things that local governments are going to have to plan for and include as part of their analysis of whether there's benefits or not from this bill. So it's not such a clear-cut good or bad. There will be implications that local governments have to plan through and address. I think, Laurie, you mentioned kind of the infrastructure development that's out there. I think a lot of that is still in place for kind of the hard infrastructure that local governments have received funding for, or awards for, and the state is managing. We haven't seen so many of those awards go away. But it's also really important to obligate funds, right? To contract with, to make sure you're taking next steps toward construction where that's part of your projects. But all of this will mean that local governments probably have to have more capacity to pick up pieces where it's necessary to serve and address the needs of our vulnerable populations, to plan for growth where it happens, to make the most advantage of some of the opportunities that come from this bill. And Ben, I think, talked about the Coast Guard and military infrastructure, how we can think about dual use infrastructure in these kinds of circumstances. So maybe there's good from that, but there's real work ahead as this becomes more real. Work for local governments to assess, do we have the capacity? What kind of planning and effort can we put into our decision making, and what will resources look like? I think it's one thing to say that local governments are a level of government left able to tax, but we're also talking about really limited tax bases at the local level. So the ability to make a difference in any one of those communities is limited by the tax base there, which is very different than a statewide tax base or federal. Ultimately, what we're looking at is how do we support community planning? How does AML contribute to the capacity of communities so that we can maintain and leverage the partnerships that we've got, and especially the folks around on this call? How do we kind of structure our economic development opportunities? I want to say there's kind of this opportunity for economic diversification, but I would say optionality I don't know if that works or not, but right, lots of opportunities that maybe we'll have to think more about. We want to make sure that there's robust enough safety and emergency services, support services at the local level where there's resources to line up with those, that we want to promote intergovernmental cooperation, not just local, state, federal, but local, tribal. I think is going to be really important in these coming years. And then we want to make sure that we've got the data, the monitoring, and the kind of feedback loops in place across all of it, so that if there's lots of noise, that we're able to monitor, like where do we really need to focus, and how do we make a difference in our decision making. Laurie, those are the things that I'm thinking about in relation.
Oh, that's all? Those are the only things that you're thinking about? Okay, thanks, Nils. Such an amazing list. I mean, and I just want to say, such a huge effort put out by AML to try to catalyze communities around these big projects. Alaska is so not going to solve its problems one sector at a time. We're going to solve them when all the sectors come together. And AML's just been fabulous at bringing so many groups to the table, especially around energy projects and big infrastructure projects. So just a real shout out to you, Nils, and your team for all the work that you do, and Ben, you and your team for bringing really helping people navigate as well all the compliance pieces of the conversation. So much compliance in these how we implement all these amazing ideas. So just definitely gonna take us all to figure it out. And we're gonna end our time in the panel with probably the person that everyone has been referring to the whole time, which is Monique. We're going to put her on the hot seat to talk about healthcare and in particular Medicaid and the implications there. But I can't emphasize enough. We're highlighting these issues, and I know that's where your questions are, but there are so many more aspects of this bill. I think we could do probably 20 more webinars and barely scratch the surface of all the different topics that are touched on in this bill. But again, when we've asked people kind of what they're most interested in, these have been the topics. And Monique, we're so excited that you could be with us. We know your life is so incredibly full. I'm going to put my screen back up for you because you've given me some slides here. So give me 1 second. Maybe you can introduce yourself as I make the technology work here.
Well, good afternoon. Thanks for staying on. And I'm definitely feeling the hot seat right now. I serve as the Vice President of Intergovernmental Affairs at the Alaska Native Tribal Health Consortium. And we've really been diving into some of the provisions really impacting Alaskans in the reconciliation bill. So I think that as we look at these, I'll also say, we're just beginning to sort of scratch the surface on Medicaid provisions, right? Like I've seen a question in the chat about individuals who maybe work 80 hours, but their 80 hours isn't a 10 hours a day, that they have really unique schedules. And I realize that's kind of one of those issues I need to jump into a little bit more, because we do have a lot of folks in our state that work really unique schedules, right? 2 weeks on, 2 weeks off, 3 weeks on, 3 weeks off. People participating in subsistence activities, and what does that mean? I will say I tried to do a little bit of homework when I first saw that chat come in. I believe it's some of those work requirements that we'll talk about are looking back at the previous month, but I think I have a lifeline also on the Zoom with us today, Jen Moreau, who's from the ANTHC IGA team, Intergovernmental Affairs. And if she has some more information, maybe she can add it in the chat for, I believe, Tina was her name. So again, I'm just beginning to sort of scratch the surface on some of the provisions in the reconciliation bill, HR 1. And really trying to get at how are Alaskans impacted? How should we be thinking about our friends and neighbors, ourselves, the people we serve, our communities, and some of those impacts? So one of the ones we've heard about a couple times already is Medicaid community engagement requirements, otherwise known as work requirements. And that is really a requirement that individuals 18 years to 64 years, under 65, are participating in qualifying activities of at least 80 hours per month. And that can be working. It can also be individuals who are maybe participating in job training, education, volunteering. This is going to have a really broad definition. And I think, one of the questions that Foraker received at the beginning when folks were just registering is, help me find a middle ground in this, right? As we think about maybe folks of different political persuasions suggesting work requirements are really for individual, really designed to incentivize able-bodied adults to work. Maybe other side of the equation, as you think about that pendulum swinging, is work requirements are going to negatively impact elderly, children, disabled populations, right? And I think that when I've tried to answer that variation on a theme of that question, I think what we can all agree to is administrative processes should not stand in the way of Alaskans being eligible for the programs and getting their applications approved, right? Jordan talked about challenges our state has faced around processing applications, which I always chime in and say, it wasn't that long ago. I was working at the state of Alaska and faced with a pretty significant application backlog when I was at the state. So I think that's one of the things that we can really do as a state. Lots of nonprofit associations on local governments, as we can help people, right? We can help people complete applications. We can help our state understand ideas we have for streamlining some of those exemption processes. And in the healthcare delivery system, we've already started those conversations with the Department of Health. So for example, pregnant women are exempted from work requirements for Medicaid, right? We're specific to Medicaid. We're going to talk a little bit more about SNAP in a minute. But are there things that the state of Alaska can use in the Medicaid payment system to sort of automatically flag individuals who are pregnant? So if someone is pregnant, they're receiving prenatal services, can our state sort of trigger that so that they can automatically provide that person an exemption? So those are some of the things that we need to think about as a state together to really minimize those impacts to Alaskans so that they can get they qualify for the programs, they receive the programs that they qualify for. So additional exemptions for work requirements, community engagement includes Alaska Native and American Indian people. This is another group as I think about and been helping people at ANTHC. Yes, we tremendously appreciate the efforts our senators really took to implement exemptions for Alaska Native and American Indian people, for seasonal workers, for those perhaps not so traditional, but people working not so traditional work schedules. And we're going to have to figure out how we really implement those in our state. A big area our senators were able to get in the bill is really finessing language around people living in areas of high unemployment or insufficient jobs, as you think about Alaskans in some of our most rural communities participating in subsistence activities. And how do we acknowledge that through maybe a little bit more bureaucratic process than we would really like? And some measures around seasonal workers are coming together, right? Really looking at 6 months perhaps of eligibility. If someone is maybe like myself, who worked in a fish cannery all summer long, can we average out the hours that that person worked there somehow to acknowledge that individuals work in fishing industries, their moose hunting season, where they're putting lots of time and energy and effort into a condensed period of time? How do we acknowledge that? So more to come on those provisions. As Laurie said, we're going to be unpacking this legislation for a long time. A really important one I think to highlight too is Medicaid re-verification. So right now, when a person is found eligible for Medicaid, they have that coverage for 1 year. But beginning in December 31, 2026, also, right, we have time. And I think the biggest disservice we can do is to really cause a lot of panic at this point amongst people who depend on Medicaid for their health care or depend on SNAP benefits to feed their families, and taking the time to really figure out how our state can implement this. Jordan alluded to conversations with the legislature. We're really going to have them put the dollars and staff towards implementation of these. Otherwise, we know Alaskans will be negatively impacted. So the Medicaid expansion population will move from that every 12 months. You're determined eligible and you receive that program coverage for 1 year. Now the Medicaid expansion population is moving to every 6 months. Again, we're going to really, excuse me, need to put the resources towards our Division of Public Assistance in terms of system upgrades, staffing, the virtual call center that Jordan mentioned. These are the things that are going to minimize the impact to Alaskans. As we know, people are going to be submitting more and more applications. Next slide, please. Retroactive coverage. Someone asked, how are healthcare delivery systems preparing for this? This is one of those, right? At ANTHC, and a lot of healthcare providers, regardless if they're tribal or not, dedicate staff to help screen patients to see if they don't have healthcare coverage, are they eligible for other services like Medicare, VA, Medicaid. Right now, when we help someone apply for Medicaid, there's a 90-day retroactive coverage eligibility determination made. If we help someone, were they eligible also 90 days from now? That is going to change to 30 days for the Medicaid expansion population. That makes up about 68,000-ish of our 225,000 Alaskans on Medicaid. The traditional Medicaid population, think about everyone else except for probably those adults without dependent children, is a really easier way to think about the Medicaid expansion population. Everyone else is going to see a decrease of that retroactive coverage from 90 days to 60 days. Again, beginning December 31, 2026. That is a date to sort of remember that we're aiming for. Some provisions are sooner, but a lot of the big ones really are effective that date, December 31, 2026. HR1 also requires state to impose cost sharing. I will say we already have cost sharing for our Medicaid recipients here in Alaska. There's some very specific exemptions for primary care services. We want to make sure people get connected to services that are receiving preventative screenings so that they don't have a more catastrophic healthcare diagnoses. Let's know if we're teetering on the edge of being pre-diabetic. We want people to know that sooner rather than later. Cancer screenings, etc. Exemptions for individuals receiving substance use disorder services, and then individuals receiving their care at a federally qualified health center. Again, this is something that exists in our Medicaid population, oftentimes in the healthcare delivery system from the provider side. It almost equates to a cut in reimbursement though, because most providers are not going to let a small copay stand in the way of someone receiving healthcare, because it's the ends doesn't justify the means, right? And that, so it's a challenge. It's minimal in terms of the amount that can be charged, but it's something we're going to have to manage so that we don't too negatively impact healthcare providers and really discourage them from seeing Medicaid patients, which is already a challenge in our state. Next slide, please. Address verification. This is what I wanted to touch on. Seems a little bit more technical in nature. This requires states to confirm Medicaid recipient address information using a reliable data source. The one that typically comes to mind is the National Change of Address Database. This is a concern for Alaska generally, but especially residents in rural communities, because sometimes there's not a post office, right? Sometimes there might be a post office, but it's not regularly staffed. So we found in the Medicaid redetermination process, which is a really intense process that the Department of Health just undertook for every Medicaid recipient, this should be more of an automatic process. You might hear it talked about as an ex parte process, and a process where we can just try and renewal people's information automatically. This process did not work well for Alaskans. Could be for a variety of reasons, right? We got PO box addresses, we got physical addresses, we might have some people might go back to their home region to participate in subsistence activities in summer. They got an Anchorage address during the school year. This didn't work well. So we're a little bit concerned about this sort of seemingly technical process could impact Medicaid enrollment. 1115 waivers are waivers that are really designed for states to say, hey, these Medicaid rules don't work for us well in any given state, and we want to do things differently. And it really allows states to waive certain federal requirements of the Medicaid program to really better meet the needs of residents of your state. So these waivers already require budget neutrality for the federal government. I will say, states have been able to describe budget neutrality in kind of a squishy way. This is going to move it to the chief actuary for CMS, the Centers for Medicare and Medicaid Services. So a little bit concerned about 1115 waivers as we think about things our state is considering, like health-related social needs. Can we do things differently to address healthcare that's not in a doctor's office? Some of these things could be potentially negatively impacted if they can't really prove up budget neutrality for the federal government. Next slide, please. I'm only going to touch on SNAP provisions quickly. I think Jordan did a great job of highlighting those. I think these SNAP provisions, one I really wanted to call out is a special provision for Alaska and Hawaii. So HR 1 already had, let me back up. SNAP, food stamp benefits, supplemental nutrition assistance program already has work requirements for recipients. But there's been some pretty big exemption areas, including ages. HR 1 requires work requirements from those 18 years of age up to 65. There was originally an exemption for those individuals over 55 and over. Pregnant women are exempt. Alaska Native and American Indian people are exempt. Those individuals who are medically frail and parent of in a household or other member of a household, maybe grandparent, caretaker, relative of some sort. If they have a dependent child under the age of 14, they can qualify for an exemption. So our senators really worked hard to get an exemption from Alaska for this because of the unique nature of employment in our state. So it's really defined. It doesn't say Alaska and Hawaii. It says non-contiguous states. Partly because of how the budget reconciliation process works. They had to be sort of use a lot of ingenuity to figure out how to get this in here. And it really requires, because we typically in Alaska have a counter-cyclical unemployment rate. Things going bad in the lower 48 because of high gas prices work out well for a state like ours. So our senators were able to get a waiver from work requirements in areas of the state where the unemployment rate is over 1.5 times the national average. So this is something we'll be tracking regularly of how we implement that in our state like ours. Largely because of some of the symptomatic problems our state has had with timely application processing, this next fix or sort of a one-time only extension from implementation of work requirements, states can apply for a waiver. This is almost entirely because of Alaska and some of the sweeteners, as the media was calling, to try and make it more palatable for our senators. This allows states to get a 2-year extension on implementing work requirements. Our state is implementing a eligibility system upgrade that should be completed in 2028. So that magical date of December 31, 2028 is not just so random, really in an attempt to allow Alaska to get that eligibility system working better. And then there's some special SNAP exemptions for income requirements that we're diving into now, kind of a technical beast. So more to come on that. Next slide, please. Cost sharing. This is some great data for folks to look at. I will say our state has really improved their error rate. In FY23, we were up over 60%. That error rate, there's some, I will be sure to provide the link so that you don't just have the slide. There was new error rate data provided at the very end of June, like June 30 or July 1. And Alaska's really improved. But if you look above, you really have to get down to to like 8%, less than 8%. Now, if you look at this, most states are going to have a pretty big share that they have to contribute, because the national average error rate is 10.93. I will say, when you also dive into this data from the USDA, even though we have a high error rate, I felt a little better in that most cases it's in the benefit of the SNAP recipient, where we are over resourcing people versus under resourcing people with those benefits. Next slide. I think just couple of quick data points. The Rural Health Fund, Jordan tackled this one. If we could skip to the next slide, and sort of getting to our time for maybe a couple questions. The state of Alaska released a request for information. It is a quick turnaround, because the state will have a quick turnaround to submit their application to the Centers for Medicare and Medicaid Services for the Rural Health Transformation Fund. This fund, $50 billion over 5 years. If you look at this, again, not an accident that you see 50% of these funds will be dispersed equally across the country. So typically Alaska doesn't fare well in distribution of these monies, just because of the small number of people in our state. This one, in an attempt to be one of those sweeteners for Alaska senators, particularly Senator Murkowski. I think we've all seen those news stories, right? This fund was, one, doubled from 25 billion to 50 billion, and two, that's why you see that 50% equally distributed across states. So this has an incredible benefit for Alaska. I would really encourage folks that are interested in this, dive into the link on the screen. You can see what the state of Alaska, some of their priorities in terms of behavioral health, Alaskans with complex care needs. How do we make a more robust primary care delivery system? The RFI is going to start to give you some ideas of what our state's thinking of. And I think that's my last slide. Oh, this is one I just cut and paste right from the RFI for your review. This is a section called Department Priorities. So I think it gives you a really condensed version of what's in the RFI and what people might find interesting.
Awesome. Okay. Well, woof, thank you so much. That was an amazing amount of information.
Sorry about that.
No, it was amazing. It was so easy I was like, that's the most I've ever understood Medicaid or SNAP ever, maybe. So that was fabulous. So thank you for that. No small task, friends, to help to understand all of that. So super appreciate it. And for our nonprofit and tribal and local government folks on the call, just a real shout out to you that, Monique offered some, real world, what could we all be doing? And I think really trying to help people access these services, making the process easier, using your voice to offer suggestions, being part of the solution. I just really want to emphasize that. And Monique, thanks so much for saying all of that, because I think it's just really important to recognize that everyone on this call can be part of a solution here. We can be part of making it easier for Alaskans to access the services that they need. And really it will take all of us to help figure that out. The state can't do it all by itself. They have the burden of fixing it, but they cannot fix it alone. So just a shout out to everyone to find your role in that, and to know you've got some really amazing partners to partner with to lead the way. So Monique, again, thank you. And thank you to your teammate on the call, who's Jennifer, I think, who's answering questions on the chat. So incredibly helpful and lovely. Love a team effort there. We do have time for some questions. I think we've been able to answer most of the questions on the chat, except perhaps Margaret posted a really important question about, tracking the economic impact of all the laid off employees at the federal level. I don't know if any of our panelists are prepared to talk about that. I will just say at Foraker, we are looking for, what is the next kind of economic report, data points that we might gather. And right on cue, Margaret, you're prompting my own brain to kind of think about what that is. But if anyone wants to speak to federal layoffs and the impact of workforce because of all the federal layoffs, I'll just open it up and offer. Jordan, I see you're unmute. Do you have a comment there? Or Nels maybe?
No,
No.
I'm afraid I don't.
I don't think we don't have good data yet. I mean, I have been in real contact with the Department of Labor to try to track, all of the shifting in the job market right now. There is the national, the Chronicle of Philanthropy, which is a national nonprofit journal, has been tracking employment layoffs in the nonprofit sector, but it is all anecdotal data. Our Department of Labor does not have a complete data set yet, but I have certainly been asking for that. And as soon as we have that data, I'm excited to share it with you. I don't know, Tiffy, if you have a sense of any of the national sense of that either.
I mean, I don't have any hard data for you. I can say that we do know, being in DC, I'm married to a federal worker, that, every day it's a new department that is being cut. And what that means on the ground is that there's literally not people there to answer your questions. If you're trying to, get questions on grants and contracts, if you're trying to reach someone within the state, but you have to go through DC first to find, your state contract, there's just not a person there to answer anymore. So that's something that we are trying to figure out. I will also say that NCN is working on kind of a new project to try to figure out the impacts of the federal funding cuts, which will then also play into the workers as well. But that's very early stages as well.
Thanks, Tiffany. And I will point out the other, implication around jobs, which National Council has taken on, Tiffany in particular, become a student loan nerd, and I mean that in the best possible way, about kind of what student loan forgiveness looks like and its impacts in this budget bill. Tiffany did recently a video training on the topic. Danny just posted it in the website. So if you're interested in that, we do know that has an impact, especially on our workforce in the nonprofit sector, because people leave the sector because they can't afford to pay back their student loans. And so our colleagues at the Nonprofit Association in California has done extensive research on why people leave the workforce in nonprofits, and student loan debt is one of them. So we all do pay a lot of attention to this issue, and there was quite a bit in this bill around the change in student loan forgiveness, and especially for those who work in the nonprofit sector. So I don't know, Tiffany, if you want to say anything more about that in this hot second, but.
Yeah, a couple things that people should know about. One, they're changing the repayment plan under the bill. So if you're in SAVE, which is kind of the biggest one, I think 8 million people are in SAVE. One, your interest is going to start being charged in 2 days. I think August 1st, they're going to start charging interest again, even though you've been in deferment for probably a year and a half. And two, your repayment plan as a whole is going to change as well under this bill in the coming months. So check out the webinar, though. It has fantastic information about all of these details.
Awesome. Thanks, Tiffany. And thanks for all your hard work there. And I know our colleagues in California just posted some additional resources. We'll try to put those out as well, as we can find a good venue for all of you to see them. Danny, I'm just checking in with you. I think we have time for one more question. If you can see a question in the chat that I may have missed.
I don't, like you mentioned, Jennifer, with A&THC was really great about answering a lot of those very specific Medicaid questions. However, if there's a Medicaid question that you do not feel was fully answered, or you still have some more questions around that, feel free to drop them in the chat now. Maybe we can have some more team sharing of those questions.
Well, I'll turn to my panelists and ask if you have a question of someone else on the panel. We have time for a minute. And Jordan, I can also bring up your slides. Yeah, go ahead.
No need for my other slides. They're going to show the relative impact of various departments as compared to what we would pay out with a statutory dividend. It's breathtaking. So what I did want to say is I know we're focused on HR1, but there are other things happening at the federal level that will also have dramatic impacts on the state of Alaska. And what do we do about that, right? There was some talk about federal hiring freeze and how that might impact whether or not in the timeline it takes to get answers to certain questions. I've heard anecdotally that there may be delays in payments from the federal government to the state, which then could exacerbate the cascading kind of issues we have as it relates to delayed payments from the states to its nonprofit partners in delivering essential state services. The rescission package, which is not the topic of today's conversation, had dramatic cuts to funding for public radio and public broadcasting in the state of Alaska, which will have, well, that's a topic for a different call, but it is
sure.
all interrelated and it is all happening now. And so for those of you who have kind of observations about those and the impacts on your organization and your ability to deliver services or on your communities, please don't hesitate to share those with Foraker, because our analysis of the impacts of funding decisions on nonprofits are ongoing.
Absolutely. And to that
dynamic.
To that end, we do have a link on our website we're calling real-time consequences. And I'll have Danny put that in the chat bar. If you are experiencing frozen funds, canceled funds, delayed funds, if you're being called in front of a congressional hearing in Congress, if you're worried, if you don't know what to do next, we do want you to fill out that form for us. That does help us. That triggers our team to reach out to you and have a conversation to help you figure out what's next and what's possible. There are many, many, many lawsuits. I've lost track where it's over 300, maybe 400 lawsuits for many of the decisions that are happening out of DC. And we still have yet to see how all of those will play out. And that is we haven't really mentioned that, but I'll just add that is another piece of the complicated puzzle. Tiffany introduced me to a topic on day one called Head on a Swivel, which is kind of how we describe this moment in time. And that is absolutely how we all feel about what is going on right now. There is just so much going on. So we hadn't mentioned all the lawsuits, but certainly there are many of them on all sides of the aisle. And really we're relying so much right now on the courts. 357, there we go. Thanks, Tiffany. We're relying on the courts to help us kind of sort out many of the, how the money will flow or if it will flow at all, and the impact on real people and real lives all across the country. So much more to say as we peel it all out. As we round out our time today, I just want to remind you all, this is a series we're calling Rapid Response. And our head on a swivel means we're paying attention to public policy at all levels, state, local, federal, tribal, trying to be a resource to you in partnership with all of these amazing people you've heard from today. We're trying to update our rapid response page with as much information that isn't behind paywalls as possible. There's a lot of information that's available that are behind paywalls that we can't share. So just call us and ask us. We are experiencing a lot that people don't know what to do next. They know they might be in trouble. They know they might need support. They know something's going on, but they feel really stuck. And we just want to say, don't let that stop you from calling us. We're happy to be a thought partner with you and try to figure out what's next. We are offering free what we're calling office hours, which is just one-on-one time. You can sign up for them. We've got a handful of topics right now, but if you don't see a topic you want, just ask for whatever you want. We'll try to figure it out. And then when we're not doing all of this, we're just doing regular Foraker stuff. This is regular Foraker stuff we're doing all the time. And we're happy to do it with you. So please reach out anytime if we can be of service. That is our goal. I want to take a moment to just thank again our amazing partners in this work. We've just so grateful to AML, to AFN, to ANTHC, to Jordan and his team, and to our friends at the National Council of Nonprofits. We could not do this work without you, and we sure wouldn't want to. So thank you everyone for taking the time today. Really, really appreciate you making space for this conversation. Lots more to come as we learn more. And with that, my team and I will stick around for final questions, final thoughts. But have a great day, everybody. And thanks for being part of the solution as we continue to navigate our way forward.